In this video, we're going to be talking about tracheostomies, and some indications for placement of a tracheostomy is head and neck cancer, severe trauma to the neck and mouth, prolonged or coma, inhalation of smoke. Our nursing care or interventions would be to assess our respirations, our O2 stats, our ABG levels. We need to assess the stoma for purulent drainage. We also need to have skin assessment of the stoma. You're going to keep suction by the bedside, an ambu bag by the bedside, and a spare trach tube by the bedside. Some complications that can occur from having a trach is tracheomalacia, a tube obstruction, or tube dislodgement. We're going to teach our client about reporting to the physician coughing up blood. They need to keep a suction device with them at home or even in their vehicle. They need to report to the physician yellow, smelly, bloody, or thick mucus. They need to call 911 if they experience any shortness of breath. And the outcome from placement of trach tube is tracheostomies help reduce ventilator-associated pneumonia. And our case study for a patient with a trach, a nurse is caring for a patient who has medullary thyroid cancer and surgery. The patient was transferred from the ICU several days ago. She has a tracheostomy. She's receiving high flow oxygen at 8 liters per minute. The nurse learns during the shift report that the patient is alert and oriented, and she has been able to perform her own ADLs independently, but she has a large amount of yellow and green secretions from her stoma. She avoids the use of home suction and trach care. She expresses in written communication the frustration she feels after losing the ability to speak. So some of the things that we're going to do as a nurse, we're going to provide bedside suctioning, oxygen tubing. We're going to teach the patient trach care, how to wash her hands. We need to use half-strength peroxide with sterile water. She needs to change her inner cannula with sterile water every 8 hours. The importance of preventing clogging the tube and decreasing your risk of infection. And before they start an antibiotic, we need to make sure we obtain a sputum culture.